Cases of the Omicron coronavirus variant are on the rise in many countries, including the United Kingdom. Today, the UK Health Security Agency has said there have been over 17,000 additional confirmed cases of the Omicron variant across the UK. That brings the total confirmed cases in the UK to 177,000, over 177,000. And the number of deaths in England of people with Omicron has risen to 49. Now, we can talk more about the situation across the channel to Professor Peter Openshaw, immunologist at Imperial College London. Thank you for talking to us today, Professor. Now, those figures on the surface do seem somewhat alarming, but we are also seeing with hospitalizations that there are fewer cases of patients needing, very serious care and oxygen, etc. How do you view the situation right now?
Well, it is almost too early to say, I'm afraid. I mean, we do see Omicron cases rising very, very sharply, as they did in South Africa. What we don't know is whether we're going to be seeing some sort of plateau and then decline. And maybe it's going to be a sharper decline with this virus, which is so highly transmissible. I must say that when we first saw this virus appearing, it made many of us feel pretty depressed. But actually, I think there are some green shoots of hope in that it does seem to be behaving a bit differently in terms of the type of disease it's causing, and maybe is showing itself to be a little bit milder. What we don't know is what's going to happen when it moves into the older adult population and also in those with predisposing conditions and people who so far haven't been vaccinated or can't respond to vaccines. I think that's going to be really crucial, and we haven't seen the evidence yet.
So one of your areas of expertise is experimental medicine, immunology, of course, more broadly. To take a step back from the current situation, looking at the pandemic 2 years in now, how do you, I suppose, assess the response, the public health response to the pandemic? I suppose, focus has been largely on vaccination up to this point, and now we're hearing talk of the necessity of a booster really to combat the Omicron variant. We're seeing in Israel a fourth shot is now being brought in. Here, the French health minister yesterday was also speaking about the possibility of a fourth shot. Do you think that that's the best approach to really focus on vaccination and getting the majority of the population boosted?
Well, I think it is so important that people do appreciate that the vaccines have been exceptionally well tested. There's never been as much research put into the effects of vaccine as there has over the past 2 years. So I think the first thing to say is that vaccines are quite extraordinary in their benefits. And it's something we didn't really anticipate when we started. So it is really important to get vaccinated.
When you say in their benefits, you mean in terms of the how extreme the virus is when contracted?
Yes. So, I mean, it's really very, very unusual to end up in intensive care or to die if you've been vaccinated, unless you have some health condition that stops you responding to the vaccine. So these are absolutely life-saving. You know, there are, as with any type of medical intervention, there are side effects. But the safest way to get immune is to be vaccinated. Don't think that by getting infected you can have an equivalent or better immunity. That's just not the case.
What would you say, Professor, to those who, I suppose, felt that when the vaccination programs were being rolled out in the beginning and being presented as a solution to not contracting the virus, what would you say to those who now have less enthusiasm about the notion of boosters, certainly a fourth shot and maybe further shots, given that we're seeing that it doesn't necessarily prevent the population from contracting the virus?
Yes, I mean, the vaccines have got an uphill struggle to manage to prevent the transmission and spread of an infection, particularly with transmissibility of Omicron, which is a remarkable virus. I mean, if this virus had been the first virus in the first wave that had swept the world, then we would be in a very, very bad situation. I think, the time that we've had to prepare, to know what works, to develop vaccines, develop antivirals, has completely changed the whole scene. I think we mustn't put so much emphasis on those interventions when, in fact, we know that they have to go in combination with interventions that slow spread as well, which are universally effective regardless of the nature of the virus.
Okay, and just picking your brain on other, I suppose, approaches to the pandemic. What of treatment? I mean, are we looking towards how this whole situation is going to be handled going forward? We saw a huge amount of resistance to the notion of ivermectin or hydroxychloroquine being introduced as treatment to perhaps lower the numbers of hospitalizations. But we do see alternative treatments now being proposed by pharmaceutical companies. Could that, I suppose, accompany the approach and perhaps even become a more important, perhaps the most important part of the approach going forward?
Well, there's a lot to say about that. But I mean, in brief, I think what has been extraordinary is that we have been able to mount really large-scale clinical trials to show that drugs like ivermectin do not work, hydroxychloroquine does not work. But what does work are in the later stages of disease, when it's very inflammatory, steroids and drugs that block pathways like interleukin-6, tocilizumab. These really do work in the later stages. Antiviral drugs don't work at that stage, but they do work at a very earlier stage within the first 3 to 5 days of development of symptoms. I think antiviral drugs are showing their benefits, but they don't work in that later inflammatory stage. So we've learned a lot about which drugs work at which stages, and that is a remarkable thing.
Okay, that's all we have time for. Thank you for your thoughts on that, Professor Peter Openshaw of the Imperial College London. Thank you.